We save lives. We rescue, right? That's what we do. So that's a natural strength of the healthcare system, which is it's also Achilles' heel, because if you want to unleash exponential technology and exponential growth, it's not about rescue. You don't wait for a rescue before you unleash that. If you wait for a rescue, you're going to get into trouble.
This is Straight Talk in the COVID economy, and my name is Larry Quick. Our world has changed and there's no going back. The COVID economy is now very real. We are adapting to telework, Zooming, online learning and new industries like PanSafe and other opportunities revealed by COVID-19. The challenges are also with us: bankruptcies, unemployment, debt and confusion. In Straight Talk in the COVID economy, we meet thinkers and innovators who bring insight and information into the opportunities and risks of our rapidly emerging COVID economy. Straight Talk in the COVID economy is brought to you by Resilient Futures. This is alongside our partner, Impact Africa Network. Impact Africa Network is an innovation incubator based in Nairobi, Kenya. It seeks to be a catalyst for the next Silicon Valley in Africa. Impact Africa Network needs all the support we can provide. So please donate at www.impactafrica.network. So I'd like to welcome everyone here to today's discussion with Chua. And Chai's in Malaysia at the moment, and we'll let him tell us the story, but he's been caught between a rock and a hard place, and he is the actual rock in the hard place, because he's in Malaysia on holiday looking after his mother, and he lives in New Zealand, and he's got his young family, his young daughter in Australia with her first birthday, but he's stuck between two places. So welcome, Chai.
Thank you, Larry.
Yes, if I can just give a bit of background. Chai was appointed Director General of Health in March 2015, and he acted in that role for 16 months prior, and this was in New Zealand. He's originally from Malaysia. He studied at Canberra University before commencing a career with PricewaterhouseCoopers in New Zealand and internationally. He's been a prominent figure in New Zealand health sector for 25 years. He was the National Director of the National Health Board. And after 38 years, 27 in healthcare, he's taken time out to listen and observe and think to decide his next move. And that's obviously going to be in Malaysia for a while. But he spends time, he's really got an interesting background because he enjoys spending time with people, and he's a very, very approachable guy. I actually met Chai on LinkedIn and a bit of outreach, and we had a chat. And so at this stage, he's focusing on spending time in things that matter to him. And firstly, if I read this correctly, Chai, it's contributing and supporting jurisdictions and organisations to transition to fit-for-purpose, future-focused healthcare systems. Secondly, help develop future leaders we need, and boy, do we need them, particularly when you hear Chai's story. And third, research and support implementation of new and better ways of caring for seniors. Thank you, Chai. You can take me on as your personal project if you like. So my opening question is, how has healthcare met the challenge of COVID-19 in your view at this point?
Yeah, so I have the luxury of now no longer directly involved in managing healthcare, and to sort of stand aside and kind of be a informed observer. And it also gives me a lot of time to actually do a lot of research and talking to colleagues around the world whom I've developed networks over the years. I were to actually look at healthcare, how they've responded to COVID-19, I think I would take the approach of doing a report card. And in the report card, there would be 3 headings. And the first heading would be preparation. The second heading would be response. And the third and final section would be recovery and rebuilding. So if I were to look at the preparation part of the report card, it's a fail. I think it's a fail for international institutions. It's a fail for most countries around the world, with some minor exceptions. I want to touch on that. And the reason why it's a fail is because it's not like we have had nothing between the Spanish flu and COVID-19.
Correct.
So when you kind of look at even the 21st century, so in the short 21st century, we had SARS in 2003. And interesting, in 2003, I was also traveling this part of the world when SARS broke out in Hong Kong. So it's kind of deja vu for me. And then swine flu was in 2009. And then the Middle East Respiratory Syndrome MERS in 2012, the Ebola outbreak 2014, and then the Zika epidemic in 2015, and the list goes on. So by and large, most governments ignored the call for preparation, and think there were a few interested parties, in terms of infectious diseases, scientists, some academics, and possibly one or two global NGOs. And I think the standout is the Gates Foundation with their focus on global health. So, but apart from these guys, literally nobody paying attention. So I give an example around. So I was actually holding the post of Director General around the time of the Ebola and the Zika epidemic. And apart from my public health specialist and my national director for national emergency, very few people really talked and worried about this thing. And I remember having a conversation with them about how do we get our ministers and politicians or even the health sector, being prepared for this stuff. And if I'm really honest, no one was really interested, apart from, well, you just keep us posted. If it really becomes a problem, you let us know. And that kind of response kind of gives you an insight. And if you look at how well New Zealand is supposed to be doing right now, that's the legacy of the background, right? So you imagine how much better the response could be for New Zealand if we had a much more proactive approach. So in that specific example, so the only thing that I could do for my colleagues was to say, look, I think we can do things under the radar without necessarily attracting a lot of political attention, because the minute we attract that, then we're going to get diverted into all sorts of reports and meetings that actually doesn't deal with issues. So some of the practical things was to really start to look at the conditions and the volume and the supply chain of our pandemic stock, whether it was medicine or PPE equipment. And I have to say, my national director for emergency management was a very young lad, and he was very enthusiastic. So he really, really went after that. And I think that one of the reasons why the New Zealand pandemic stock is where it is today is largely because of his work. So he gave me a plan to say, if we do this under the radar, can I submit a list of things that we could actually build up each year under the radar so that we would have a credible pandemic stock? And that's exactly what he did, right? So when you kind of look at that, it is actually not, from my point of view, it's not an adequate response.
No.
Right?
That's one of the things that we find about, well, it's government, because a lot of times because of the political motive and the dogma behind that, the policy, and also the fact that they've got short terms to do what they hope to do. And they're either just come out of an election or just about to go into one. And I think that but we also find that in organisations, in Resilient Futures.
Correct.
We call it having the good view, the foresight of the immediate and emergent conditions at scale, and identifying opportunities and risks inside that as a permanent action that organisations and government need to take. And I guess what you're saying is that you did that, but you were constrained by the levers of government and it's a bit like, I can remember conversations about water purification and all this sort of stuff, and
Yeah.
people being attacked for desal plants and all that until
Yeah.
they needed the desal plant. Then everyone forgot about the fact that they've been attacking.
Yeah.
But this lack of preparation, what you're saying, is really created part of the problem.
Yeah, I think I want to caveat that because I actually had a very supportive minister, right? And he I know worked extremely well with him, and I trusted him, and he trusted me, right?
Yeah.
But I think one of the things that I realized about, even for a minister, and he was quite senior in cabinet, was that the government had so many priorities,
Yeah.
right? And if we were to try and actually put a sizable budget bid to actually raise our pandemic stock level, look, I mean, he knew that the chance of getting it through was almost zero.
Yeah.
So, but he did give me sufficient flexibility around to let me do the things I could.
Yes.
Right. And I think that was actually went a long way to actually part of building up the pandemic stock in New Zealand. Right. He could actually stop me anytime, but he didn't.
Yes.
Right. So I think in that sense, we were fortunate enough to have that sort of uh, uh, implicit political support, recognizing the reality of how politics work.
Yes.
And I think that's quite important, right? Anyway, but other countries I think did a lot better. I think there were some countries that did a lot better, and I think the standout for me definitely is South Korea, and I think Taiwan, and to some extent Hong Kong and Singapore, right? And if you look at the common theme between all four of them, is because they were all hit by some of those previous epidemics I talked about, right? If you look at Hong Kong and Singapore, they were very badly hit by SARS, and then in South Korea they got hit by MERS, and I think Taiwan got hit by the H1N1.
Yeah.
And they knew, so they were they actually learned through making mistakes during that time. And so they were more ready than most in January when this thing popped up on the scene.
Yeah.
Right? All these countries were quite early in terms of taking stuff. So anyway, so from...
Labour the point, but if I could just say that if we were to think about this strategically and say health care, it's sort of an important part, and I guess I'm thinking this from the Australian perspective, that we've had big issues in healthcare for a long time.
Yeah.
And, this has made it more complex, and if you like, it's brought healthcare to the fore in terms of spending more money on healthcare that supposedly we didn't have to do, and but just government in general preparing for the future. We had lots of warning on the fires, say for instance we had it.
Yeah.
Lots of warning 10 years ago by Ross Garnaut's report, etc., and basically ignored right the way even until last April. They were warned, etc. And I just wonder if these long-term issues, such as health, such as climate, such as all those things, are really not being brought to the fore and dealt with. I don't necessarily need a comment from you on that, but I'm just thinking from an audience perspective that it's not just healthcare, and it's not just climate change. It's a whole range of things that if we, we've just, say, I can remember working on the telework, National Telework Committee, or with them in 2013. The government changed and they got rid of it and said it was too expensive, even though they didn't actually put any funding into it at all. It was all funded by organisations.
And those in healthcare can't know this stuff for a while, but the problem is that they don't know what to do with it, right? Health, the guys, that the amount of money and the things you do in health, and makes very small difference to a population. It's great.
Just repeat that if you could, please.
So most people in healthcare who are senior enough actually do understand that the things we do and the money we spend in healthcare and rescuing life, all that is necessary, right? But in terms of looking at a nation's and a population's well-being, we play a very small part. It is the other things that the investment need to go into, like proper housing, proper jobs,
Yeah.
transport, education, et cetera, et cetera. And in the particular 21st century, the whole issue around sustainability and actually living with the environment rather than against the environment.
Yeah.
Right? And those things are all becoming fundamental to healthcare now. Right? But I think that awareness amongst health decision makers is not able to be translated into making decisions by healthcare leaders to actually critically look at how they're actually spending the tremendous amount of budget that they actually have in healthcare.
Yeah.
Right. So I think that what COVID-19 is probably going to do is in the current phase, it looks like a lot of money is going to be thrown into healthcare.
Yep.
Right. I think that what the second phase will come will be now, because all governments are going to face deep recession and budget deficits issues.
Yeah.
They will have to go there. They will have to ask the health and all other government expenditure portfolio to have a look at their baseline and ask the question, is the money we are spending in education, health, et cetera, is this the best way to spend our money if we were to look at the lens of the resilience and the well-being of our population? That, I think, is a conversation that will be taking place in the post-COVID-19. And it won't take long, because I think most governments are going to run to fiscal deficit issues.
Oh, absolutely. The debt is immense. It was before this happened, but this has just exacerbated huge amounts of sovereign and domestic debt all over the world.
Right. Anyway, let me move on to the second report card item called the response. So in the response part of the report card, there's a section A and a section B. So the section A in the response card really talks about how the health sector responded to the specific COVID-19 pandemic. I think on that part of the report card, it's a mixed result. It's a mixed result in terms of response because there are countries like Australia, Germany, New Zealand, Iceland, some kind of countries that's been held up as, at this stage anyway, doing the right thing, right? And that kind of normally is portrayed by, if you look at the number of infections, the death rates, those are kind of two obvious indicators that's been used. So I think that, so there's a small bunch of countries that kind of held up by even the WHO and other commentators as doing the right thing, right? And then there are lots of countries where actually it's a big fail. I mean, these guys, largely through political inertia and other distractions in the politics. You can think about the US, the UK, and Italy and Spain. I'm not quite sure how much of politics play into it. I'm sure it does, but I think that those two countries have some unique circumstances that I think that they were too slow off the mark to pay attention to the warning bells. So they didn't actually respond fast enough like South Korea, Singapore, Taiwan, Hong Kong were. So they were very complacent, right?
Yeah.
So this bunch of countries, I think, let their country down, right? So stuff. Now, the thing to watch now is what's happening with the response as the COVID-19 epicenter starts to move, all right? Because it's floating around parts of Europe. It's sort of moving through the various states in the US, and it's moving down Central America and South America. It's starting to pop up in some of the more populous countries in Southeast Asia, Indonesia, and the Philippines. It's starting to make its presence felt in the Indian subcontinent, and it's very hard, particularly in the developing countries where they have very weak health system, to actually know what's going on there. I suspect we will never really know the real numbers.
No.
So if you look at countries like India and Bangladesh, Pakistan, I don't think we'll ever know. Then, of course, is the African subcontinent. If you look at what's happening in South Africa and Nigeria and in Egypt. So I can't remember the global numbers. It's kind of standing at 3+ million, approaching 4 million people infected. I think close to 275,000 fatalities. I think those numbers will continue to actually grow quite fast. And until that first wave actually rips right through all those places we talked about, then we will maybe start to see the numbers start to ease back a little bit. But then it all depends on how all the countries handle the second and the third wave until the vaccines come. So overall, I think from a response perspective, there are very few places that have sort of come make the grade at this stage. But there are far too many countries that are failing in their response.
Yeah.
And just as a postscript on the countries who are doing well, I think there are some worrying signs popping up, particularly from South Korea. And if you look at what's happening in Singapore, I think and Germany, those are important insights for nobody to be complacent. So that's why I think that New Zealand's got declaring victory far too early.
Yes.
And the reason why I say that is because of the asymptomatic nature of this virus in terms of being able to actually infect people when they're asymptomatic, and also around how infectious it is. So not only are you able to infect people when you show no symptoms, but you're highly infectious. So I think that even all these countries are now, so this whole managing of the lockdown approach, and obviously Sweden is an outlier here, the narrative government should be giving to the population is until a vaccine is found and widely available, countries should expect a cycle of putting on lockdowns, easing back, watching what happens, and then maybe having to lock down again. And I think that's a much more realistic and practical narrative. Yep. Because, and so at least people know that's kind of like in the medium term, that's our reality, right?
Yes.
So no one's going to get really upset. Then someone say, well, actually, we open our business 4 weeks time, we ask to close again. Well, it's this, right? And I think that's the issue with the narrative at the moment. It's almost like, oh, thank God we got it under control. Well, now we can open up again. Oh, but it will be terrible. It'll be terrible if we have to put it all back.
That narrative, and we were just talking about this previously, is like, there's the landmine.
Yeah.
Notice that someone steps on the landmine and they say, don't move. And that's suppression. No one knows what's going to happen, but we're pretty sure you take your foot off and something is going to happen. And just the slow release and pressure and slow release and pressure. But, I think people are treating this as some sort of linear event.
Correct.
Thing happened and then we went through it. Now it's finished and now we're back to normal.
Correct.
We talk about the COVID economy as a real thing we have to get used to, and all of the constraints and, the huge amount of risks and opportunities inside that. Organizations that we work with and many organizations have told us that there is a huge benefit they've found through telework, and that, the environment's doing better. So you can go on and on and on about some of the opportunities that created, but the risks and the obviously Australia, we're talking about 1 million people out of work. But there's a magical figure that we're somehow going to get out of it towards September, be able to take the social service payments off, or maybe even as early as July, and there'll be another 1,000,000 or 800,000 jobs that will come back to life, and then we'll just sail on. There'll be a bit of trouble, but we'll just sail on.
Yeah.
You know, that's just a fantasy as far as I'm concerned.
So this really brings me on to the third report card, which is the recovery and the rebuilding. So I think your point is the recovery and rebuilding shouldn't be seen as a linear, you know, we've weathered the storm, now we can get on and rebuild, right?
Yeah.
Rather, I think the recovery and the rebuilding is a cyclical thing, right? We're doing some stuff, we think it works, we're going to open up the economy, we're going to test some stuff, and then, oops, some of it worked, some didn't work. If it didn't work, we're going to have to circle back, do some stuff, and then try something again. And it's kind of like it's a complex adaptive approach to solving this complex problem, right? So rather than taking a linear approach. So in terms of scoring countries on recovery and rebuilding, first, I think it's far too early to score anyone. But I think that looking at how different countries handle the response stage will give an insight into how they're likely to approach the recovery and rebuilding. Now, for example, if the response is linear, the recovery and rebuilding is likely to be linear, right? So I was actually talking to a bunch of millennials yesterday, and I asked them the question, so what is your guys' take about COVID-19 and what are the things you guys worry about? So, you know, hands down, they were saying our jobs and our future.
Sorry?
Our jobs and our future. So they are very realistic that their jobs are at risk. And secondly, they realize that, so once there's uncertainty about their jobs, they then are very uncertain about what their future looks like. And I think that that's the stuff, when we come back to actually scoring a country, how well they manage the well-being, right, in terms of response, this is the underlying stuff that no one's dealing with. So the anxiety of the young people, the anxiety of the baby boomers, the anxiety of the, the first responders, the frontline staff, the anxiety of all the people who are missing out on all the other health services, all those things are currently in the response phase of any jurisdiction I've seen so far. There's almost zero investment in that. So again, it's kind of like the linear response. We'll just have to deal with COVID-19. Once we can't go handle that, we might turn our eye on these other stuff, right? But actually, when you hold positions of leadership at a political or at a policy or at a professional level in the 21st century, you will fail in your duty if you take such a linear approach.
That's really interesting you say that, because our whole thinking and strategic frameworks we teach are based on complex adaptive systems, and really understanding how a new mindset, skill set, and strategic focus and action needs to take place out of this. And I think you've put it right, and it takes us back to the beginning of when we were talking, is that the narrative that was presented in COVID-19 was very linear, as we've got to do this, then we'll get out of that, and then we'll be back to normal. And you would have seen the, hopefully you've seen the Four Horizons.
Yes, I've seen it. Yeah, it's good.
COVID-19 and beyond, and we talk about, zero, Horizon Zero was 2019. Remember those old days? But they weren't perfect days. We had all sorts of stuff that was fragile going wrong, socially, economically, debt, climate change, fires, all that sort of thing was in 2009. We tend to forget that because the bigger pressure is COVID-19, and it's hit us like whack. So we've gone into this sort of crash test dummy pose, and we're not really functioning all that well because we're totally disoriented and shocked. But we feel, we settle back down. Now it's going to release. And, if there was TV footage over the weekend of shopping malls in Victoria were packed. And police had gone there, they would have made a fortune on finding people from social distancing. But what you have is this, we've got a COVID-19 economy. This COVID economy is real, and we've got to work with that, and it isn't going to go away in 5 minutes. And that expectation that it is wrong. And we've got to, I just see a load of people investing a lot of money in pretending that it's these conditions of, it's going to be around for 18 months. We're not going to be traveling overseas next year for holidays. We're not, all of this, and not understanding these conditions so they can reinvent their business or their life or whatever it is.
Correct.
The thing that sort of startles me is that the Prime Minister, I'm not saying, I think, I'm not a political person necessarily, but I think Daniel Andrews, when I listen to his narrative and his type of voice, is what we need to hear. What I hear from the Australian Prime Minister is someone who's devoid of understanding how you talk to disoriented and shocked people.
Yeah.
There's a way of talking to them that makes them feel not absolutely happy. It's like people have got PTSD out there. How do you talk to
correct.
PTSD? And when they're in the middle of the battle, and they have to stay, they have to stick at it. How do you talk to them? If they've maybe signed up to the army and they're going to be thrown in, and no matter what, that's a different set of situations. But when you're in this social economic malaise, this total disorientation and shock after shock comes at you because you've got the pandemic shock, the COVID-19 shock, you've got, the economic shock, then what about the fires this year in Australia? Is that going to happen again? You've got all these shocks hitting you. The psyche of the nation, what we call the organic narrative of the citizenry, the polis, that it's just like frantic. It's like, bang will go off with a touch, as is happening in America. And and what do you say to the people when it just continues to not work, rather than settle into the COVID economy? It's going to last for 18 months. It's like the Second World War. The war is
correct.
It's going to last.
Absolutely right.
This is what we're going to do for 2 years. Come on, guys, let's get into it.
That's right.
Settles into that, rather than being fraudulently almost told that, come on, we're going to get you back. And then everything. I mean, how do we do 1 million people unemployed, 10% all of that stuff? So you've got that health hit, you've got the economic hit, and then here's another health hit, and here's another one. And till people are just, we call it the crash test dummy syndrome. Bang, bang, bang. Rather than being told this is complex. There's a great article in The Age today about simple and complex stories. How do you just say, okay, guys, everything we said before is being linear and all that sort of stuff. Now it's about complex adaptive change.
Correct.
What the hell are you talking about? It's interesting in this. Sorry, just to say last point here that when we wrote Disrupted Strategy for Exponential Change, we said in there, we're going to say strategy for exponential change. And people said, well, no one understands what exponential change is. They've got to understand that. And this is the first time that it's been discussed on television programs, exponential mean. And it's out in the community to a certain extent. Like that. So.
So I think, the COVID economy, until the vaccine is found, I think no country has found the right narrative yet. And I think that the faster the politicians find the right narrative, the faster they can help their citizens and the population come to terms with what they need to do to change, to actually adapt. Because if you take a simple example, like in Malaysia, I'll go around the takeaways and restaurants, right? I mean, even with the rules about opening up the restaurants where they can operate, right? So I'll give a simple example. I went to a noodle shop the other day, right? At the beginning of all the lockdown, so he said to me, better buy up extra for your freezer because after today I won't be able to sell. So I said, well, what's happening? You can open up and do takeaway. He said, yeah, but I am only doing 30% of my volume.
Yeah.
Right? Now, I'm prepared to open for 30%, but the problem is my suppliers are not willing to supply me.
Yeah, that's right.
Yeah. So it was a very simple thing. Then now I go to another restaurant. I say, well, thank God you guys got some sort of relief. You can be going to have to dine in, right? He said, yeah, but every table has to be
exactly
2 meters apart.
Yeah.
And he says, I can normally fit in 50 people, now I can do 10.
Yeah.
So, and then it's not just the 10, it's that all the extra cost involved in screening, blah, blah, blah. So he says, look, I have seriously got to think whether I even want to reopen.
Yeah. No, that's, we've talked about this as well, exactly the same examples, like cafes. We're in Wood End here. They've been doing coffees out the front, the thing, and they've been selling soup and sandwiches and all this sort of stuff. And if you think about it, they haven't necessarily had huge kitchens and all that. We say it like this: in a service-based economy, you're a dollar per square meter economy. That's what you are, is your space. And what we've had is we don't stay at cafes anymore. So we go to one of the cafes along here and we buy a coffee and a croissant or a roll or something like that, and we go back and eat it somewhere. We're still buying. And they're looking around going, I've got all of this space and I've got all the staff, I haven't got a cook and I haven't got all that. And I'm making some money because I've been able to reduce down so far. But, someone says you can open, but you have to social distance. The costs skyrocket at that point. And you're right, I think it's, why would we come back? Now, we've got a group called the Resilient Futures Network Prime, part of our network, which is CEOs of big organisations and those sort of things. And they are talking about, we're not going to go back. We're not going to send our people back to the office. It'll take a lot of time if we do send them back. And this goes for large telecommunicators, large universities, saying, a lot of our people don't want to go back and work.
Yeah, correct.
They're quite happy to do online education. So, you've had this dynamic shift and there's no going back from it. And if you try to go back, the cost per square metre and the on costs are huge. And what your guy said is spot on, is that, I used to, my cafe or wherever it was, in my pub, I used to be allowed 100 people in the pub. Now I'm only allowed 30, and it doesn't work because what's the point of going to the pub when you've got to shout over there, and they can only have 30 people, whereas 100 people used to go in that room. And by the way, my consumption of alcohol has gone down dramatically. So it impacts my supply network, and they start to close down. And in some cases, going back creates more cost and does more damage to the economy. And at the same time, what do you get? You get suppression off, and you get the bomb going off. So we've got to think of a way of suppressing or dealing with COVID-19 in the COVID economy that can mature and find some things, some opportunities, and mitigate some risks that we haven't seen before.
Yeah. So let me just kind of jump on to another question you kind of raised, and it sort of touches on where do we look for the answers of dealing with COVID-19 and other future pandemic, right? So it's the question you asked me around what are the themes of the future of healthcare?
Yes.
So I said there are lots of ways to look at the future of healthcare, and you can look at it from a consumer's perspective, you can look at it from a health professional perspective, you can look at it from a policy person, you can look at it from a vendor's perspective, or you can look at it from a hospital perspective, or all this sort of stuff. But I think regardless of which lens you take, in the next 10 years, the future of healthcare will kind of have these three things. Healthcare will move to become more personalized, one. Secondly, healthcare will be delivered earlier and closer. And I'll elaborate on all those stuff.
Yep.
And finally, healthcare will be more precise, right? So what I mean by personalized is, at the moment, I'm not sure whether most people know, when drug companies do drug trials, right? Nothing is personalized to an individual.
No.
It's all about averages,
Yes.
right? So in the future, I think that technologies like AI and genomics, editing and screening will allow individuals to actually want to understand what their biology and the genomic profile looks like, right? And so therefore, they have a personal view about them. It's not about somebody else, it's about them, okay? Secondly is, if from that perspective, then you can get a glimpse around what are the things that could go right and what are the things that could go wrong here, given your genetic and your biological profile, right? And so that's why it's earlier. You will know if you want to earlier, okay? And the intervention and the treatment, or the corrective actions, whatever you want to call it, can be done much earlier as well, right? So for example, if someone is predisposed to a type 2 diabetes, if you know that from birth, right, then your lifestyle from birth, your diet, your exercise regime, all that stuff, you can actually modify it, right?
Yes.
And the intervention, if you can do all those things, then it's a lot closer to the root cause, rather than wait for it to become a full-blown type 2 diabetic, and then you have to go and amputate your leg.
Yep.
Right? And then it's more precise because we will approach healthcare from understanding, the individual molecular composition of individuals, and we will also understand how the persons live and work and play and how they socialize, right? So the design of healthcare for an individual will be personalized to your circumstances and your genomics, and it will be very precise, right? So it's not a standard thing, right? So these are the kind of three themes of the future, right? So the big question really is, if we are moving towards a future healthcare that's personalized, earlier, closer, and more precise, how does it solve the current issue of around equity, access, affordability, because right now, these are the kind of three big issues in healthcare, right? People can't get access, and there's a lack of equity around who's getting access. And then the issue is around increasingly people can't afford to actually get healthcare, right? So those type of questions in the future of healthcare, when people design healthcare that's more personalized, earlier, closer, and more precise, it depends on what are the values they used to actually design and architect the future healthcare system, right? So that's kind of like, I think that's where it will go. Also, future healthcare, what I call technology 4.0, are going to play a big part. And things like genomics, AI, robotics, wearables, nanotechnology, 3D printing, all that stuff are going to be really big in healthcare.
Yeah.
Now, it's not like this thing hasn't been around for. Some of them actually been around for a little while, right? Some of them are less mature than others. But for many of this technology we talked about, they have started to make inroads in other parts of the global economy, but in healthcare, it's been very difficult to penetrate. Healthcare is almost like a fortress, right? Now,
Yeah.
so the really interesting issue is then you get a COVID-19 come along, all right? So this is then coming back to the point you asked me to make around the exponential technology driving change in healthcare, right? So all these technologies are kind of like bubbling away quietly in the background, and sometimes it kind of feels like it's like a hammer looking for a nail to nail down, right? But then suddenly you get something like a COVID-19, and then boom, like the lid's just taking off. So the two most obvious barriers that's been received in healthcare is the virtual care has literally happened overnight, particularly in the primary care setting, and to some extent in hospitals, because hospitals are saying to their patients, please don't come in. You can use teleconsultation.
That's me.
Yeah, yeah. And then the other aspect that's happened is we are starting to see pockets of innovations around additive manufacturing. You know, people are starting to manufacture their own face masks, you know, with their goggles, this sort of stuff, right? And you know, suddenly there's no barriers to, you know, producing this stuff. So you see this additive 3D printing stuff also starting to take off. And then of course, this final one is a more general point, which is not unique to health, it's everywhere now, is your point earlier around the telecommuting.
Yes.
You know, so suddenly people are realizing, actually, do we really have to actually have all these meetings, bring all these people together? We can actually do it through Zoom or whatever, right?
Yeah.
So I think the point you made earlier, there are things that it will be very hard to put the genie back into the box.
Yes.
So the more important question is, will the health sector learn from this to say, you know, there are exponential technology out there that you're suppressing, right?
Yes.
And they're bubbling away, and they are kind of waiting for another COVID-19, right? And then they're going to take off again. And when they take off, they will change the way health care services are delivered.
Yeah.
So the question is, what are all these things out there now? And do we need to actually wait for a pandemic, or can we be proactive to unleash those exponential energy? Right. Now, if you ask my view is there is not a fat chance in hell in any health jurisdiction for them to be that proactive.
Say
Right?
that one more time.
What I'm saying is, at the moment, there is not a fat chance in hell that any healthcare jurisdiction will be that proactive. They will only react when we have a they'll wait for a disaster before they have to do something. Right? Now, that's why I think, Larry, in terms of a post-COVID-19 world, that's why I'm really interested around developing future leaders we need.
Yes.
So if you look at even countries who are handling COVID-19 well, right? Some of them did a lot of proactive preparation. And not all of them did, but some of them are just lucky, right? But the thing that has worked for the healthcare system is healthcare systems are always very good in rescue. We save lives, we rescue, right? That's what we do, right? So that's a natural strength of the healthcare system, which is it's also Achilles' heel, because if you want to unleash exponential technology and exponential growth, it's not about rescue. You don't wait for a rescue before you unleash it. If you wait for a rescue, you're going to get into trouble.
Yeah.
So that's why I kind of think that healthcare got to really understand the whole concept of the exponential curve movement, right? And I think that I wrote an article that says the curve really is characterized by three words: slowly, gradually, and then suddenly. And you want to pay attention to exponentials at the slowly and gradually stage, because if it gets into the suddenly stage, you're too late.
Exactly. Well, that, you know, one of the things that we've been tracking for a long time is the amount of highly disruptive changes
Yeah.
that have been changing exponentially. And we talked about 2020 as a year that a lot of thresholds in resilience, complex adaptive systems thinking. You deal with systems change at levels of thresholds where the system can't go back to what it was. And a load of thresholds have been breached in biospheres, sea level rise, fish stocks depletion, potable water. For potable water for the size of populations, etc. You could go on. You could spend an hour just talking about them like this that have gone through thresholds. And when you look at the cumulative effect of those exponential change breaches, you begin to understand that things like the future of organised health, where people treat the health sector like you'll rescue me. You know, I'll smoke or I'll do this. Or I won't take responsibility for myself, or I can't because I don't understand how my body works. I'm in 21st, and we don't understand how our body works. You know, when you hit the age of my age, I've been through so many, because I played sport and done this. I had leukemia and I've had bone marrow transplants, I've had heart operate, all that sort of stuff. And I go, that's how it works. You know, good time. And what I found is that, you know, because what I'm searching for here is what's the little catalytic action that can be taken to make this change? What's the little thing that you can put out there that grows momentum, you know, an exponential behavior change to match exponential change, a disruption. And, you know, because if I look at things like when I had leukemia, that was 2007, I was diagnosed with leukemia. No one could explain to me how I got it. And it was acute myeloid, AML. And no one could explain it to me. And I just worked very, very hard in my head and to get through it. And I was lucky enough, or whatever it is, to get through it. I didn't fight it. I just kept my energy going to be alive and enjoy myself. But then you have a bone marrow transplant. And what you understand, you're in the system. And I was in Western Australia, really rich state at that time, 2007. And if you'd seen the way the nurses were treated, the poor facility, it was appalling. And you know, then they would, when I could get around, they used to say, you have to go to this appointment, you have to wait for your records to show up. It's 13 years ago. Your records. This big file would follow me around by a person putting out files. So I said, give me the file, I'm not waiting. I'm supposed to carry my own file around. Then, oh my God, how come all this isn't in some sort of record system? And then, you know, then I was, just even now I go to the specialist, and last year I come from Woodend down there and I went, I'm over it. I travel down here, it takes me an hour and a quarter to get there. I go in, have my bloods, I have to wait for 10 people to go through the bloods. I then get my bloods and I go down there. The whole thing's about nearly 3/4 of a day for me to do that. I want to do I got told we don't do that. But then all of a sudden said, I demand to do it by, oh yes, we have a telehealth system, but you'll be the first one hospital hematology to do telehealth. I went, whoopee, you know, fantastic. I was the first one to have a bone marrow transplant, light version, as an outpatient and it was fantastic, you know. Well, you know, as far as having a bone marrow transplant goes. But the interesting thing was that I'm having these telehealth appointments and they're working for both of us. And every so often I'd go in and do a face-to-face, appropriately so. You know. And then COVID-19 hits and they go, you've got to have telehealth. You can't come in. And I went, well, I'm not now. But we don't use the telehealth system because not enough doctors understand it. So we're going to call you on your mobile phone. And I just went, that says so much to me about the health system because, you know, the keeping of, there's no data on the millions of dollars, because all you get in leukemia treatment, as you know, is medication. That's all medication, whether chemotherapy or whatever it is. There's no operation. They can't go into your blood vessels and do something, whatever. They might pick line or whatever it is. And it's all medications. There's no track record from 2007 to now, 2020, of all the medications I've had, of my vital signs at the time, of some sort of description of what my case was in one file, so they could use that as a longitudinal study on my case of leukemia with every other case of leukemia and go, here's what causes it.
Yeah.
And so, you know, my sort of wringing my hands in healthcare is things like, you know, we are in a state of malnutrition in Australia. It's malnutrition on steroids because we're malnourished. And that causes a lot of health problems, causes a lot of psychological problems. We have diabetes, we have obesity, we have all the stuff that's going around the world. There's like a pandemic for me. But you know, you go to Coles or Woolworths here, the supermarkets, and you know, Woolworths the fresh food people? Not really. That's a lie. You know, they're not. It's not fresh food because the can of stuff that's in there, like 90% of the food is not nutritious. It's manufactured, and it's okay to fill you up, but it doesn't necessarily deal with the health needs of a 21st century body. So, you know, if you look at the hump we've got to get over, in my view, is like we start here and we look at that mountain and we go, how in the hell can we just dig a tunnel and go whoosh straight through? What's the starting point? I mean, COVID-19 might show us a starting point, but I haven't seen one before.
Yeah, so I think COVID-19, it actually depends on quite a number of stakeholders in terms of how big user. I think my view actually is the consumers.
Yes.
Yeah, because I think, and I think that one of the biggest tragedy in COVID-19 is that when you listen to the narrative all around the world, there are views from politicians, from scientists, from academics, from all sorts of commentators, right? The most obvious missing voice is the patient. That is stunningly absent, and the only time you hear about the patients is when something bad happens to them. Yeah. In the COVID-19, like all these tragic cases in the nursing and restaurants, right? That stuff. And to me, that's a failing of the leadership at the policy level, at the public health level, right? Because all these guys understand this, right? You always must have a consumer at the top table when you're dealing with something that's about them.
Yeah.
Right? Because they can cut through all the rubbish, and they can tell you what they are really going through. Right? So I think that one of the things that will make a difference. So it's actually about creating a movement among consumers globally. And funny enough, Larry, I've been invited to participate in an interesting international collaborative that kind of basically says, I think we're all like-minded people. We can't really just rely on governments to do this stuff. Can we get together and maybe come out with a 4-page plan of being that we can hand over to anybody who's interested, so rather than sitting quietly as a passenger. So that's kind of one point, right?
Yep.
I think that the second one actually to me is coming from the private sector. I think the private sector is about to go through a lot of change, and I think there will be a lot of incumbents who will go out of business, and then I think there's going to be a whole lot of new ones come on, right? And I think in in the new wave of the private sector, how do we harness them for them to be able to provide solutions?
Yes.
Like what you're saying, that we drill through the mountain as opposed to having to climb over it, right? So I kind of use the phrase which I quite like when I heard from a very young Indian politician, where he says, we no longer have the luxury of leapfrogging the problem. We now have to pole vault across the problem. I really like that one. Yeah. So the other one I think is the private sector, and I think that with so many changes coming up, particularly in the field of technology and different. You talk about Woolworths, right? All the supermarket chain. These guys, their business model are going to come under enormous stress.
Yeah.
Because their supply chain are going to come under stress, right? So stuff, and how people decide to actually buy food will change.
Yes.
What food you want to buy will change.
Yes.
And then I think the third one really is the younger professionals, the younger academics, the younger scientists. No disrespect to the baby boomers, and I think that there are some exceptional baby boomers in those professions, but by and large, many are dinosaurs. Right? So it's really about
that. I'd say most.
Yeah,
No,
most are.
I'm not being disrespectful. Dinosaurs were.
No, I agree, and I think that they're well intended.
Yeah.
It's just that their worldview is 20th century.
Yes.
So what we do need to is to invest in the developing, and that's kind of one of my 3 priorities there, is to invest in developing and helping the young ones come through to help navigate some of the landmines.
Yes.
Right, which they probably should avoid, but they have to step on it. Right? Yeah. So, and I see quite a lot of them. Funny enough, through LinkedIn, Larry.
Yes.
And they are reaching out. They do want to actually understand how things works. Has this been tried before? Why do you know works or stuff?
Yeah.
So I think that for people like us in our generation, I think the best thing we can do is to share the experience. But let them figure out what the solution might kind of look like.
Yes.
And
go ahead.
And then the final one actually is the institutional politics. I think that and this is not an Australian or New Zealand issue, I think it's just everywhere. If there is, I don't know, maybe I'm optimistic here, maybe in the next 10 to 20 years, if we don't see a different style of politicians, then I think what will happen is that the role of government will diminish.
Yes.
Because I think there has been a call, and I think Bill Gates probably put it out recently, to call for a dialogue around an international gathering of people who can actually not necessarily take over the role of government, but actually to be able to actually think about how they can actually do things despite the limitations of government.
It's a shame, isn't it, when you put it that way? But how do we get the world to work? How do we have a real, it's the human condition. How do we have real humanity that is about values you've talked about, equality, equity, for all, in spite of our governing bodies?
Yeah. So I think that nurturing future leaders, whether it's political or professional or in business or even in this civil society sort of stuff, right? I think that's kind of, if I were to say what would be the biggest thing that we could do, I think would be to actually say we need to invest in them.
Yes.
because I think that they need to understand, particularly the next cohort coming through, right? They are a transitional group, right? And they're going to need to be very, very brave, very, very resilient, and be prepared to pay the price to help manage the transition.
Well, I think what we've done is, you know, with the great, I mean, I remember the 60s and the 70s. I lived in England for 10 years in the 70s, supposed to be for 6 months holiday, but I stayed there for 10, 11 years. And I had a wonderful time. And I also thought how wonderful the future was going to be from the Second World War and the street that I lived on in a place called Rivervale in Western Australia, Perth. And the pain that a lot of people went through because of that war, that here we're going to have a fantastic time. And, you know, even with the blips that I thought with the Vietnam War and all that stuff, the 70s, I feel that my generation has really let the younger generations down because we copied a version of the previous generation that really hasn't looked into the future far or wisely enough to understand what the hell's going on.
I think, Larry, it's not too late for us to actually help the younger ones.
Yeah.
I'm actually quite optimistic when I start talking to the millennials and the younger ones, Generation Z, these guys. Because when you strip away all the hype stuff, and these guys really want to contribute.
Yeah.
But they are pretty frustrated by not being given the opportunity.
Yeah.
You know, when you kind of look at all the startups these guys are trying, and you say, well, the ideas are right, but just they have just no idea how to go out and make it successful.
That's right.
All right. Your final point to me was, what were the 3 things that you were some specific takeaway for the audience?
Yes.
For COVID-19's conversation. So I kind of sum it up by saying, 1, that COVID-19 is the beginning of what will be more similar type of challenges for society. And we've got a real taste of how disruptive it is, right? And I think what the first lesson here is that there will be more coming, right? And so hopefully we need to understand that this is actually a very complex challenge.
Yes.
And I think your point around the piece in the age is that you got to attack a complex problem not by a simple or a complicated solution, but using a complex addictive approach.
Yes.
That would be the first point, right?
Yep.
The second point is that when we are starting to look at the recovery and rebuilding, any solution that is suggested that kind of looks like a pre-COVID-19 is the wrong answer.
Yes.
And the third point actually is also something you mentioned, which is this. It's a blessing in disguise that the whole concept of exponential is currently being discussed. All right, and I think that more people need to get into the discussion to lift the understanding around, if you like, the risk and the opportunities of a exponential curve.
Yes.
Right. So I would think that's kind of like those 3 sort of themes in our discussion.
Well, that's fantastic, Chua. And as always, a great discussion, you know, and we're going to be doing this again, hopefully.
Yeah.
We need to ally in some way and I'll send you some information on some of the things that we're working on. And I'd love to be involved in your initiative for leaders, any way I can, that would work in what you're doing. So with those 3 points, COVID-19 is the beginning of more similar challenges. There's more to come. Recovery, if the solution looks like pre-COVID, it's wrong. And thirdly, look for exponential and the opportunity risk that comes out of the exponential curve, which I couldn't have said better myself. So thanks so much for your time.
You're welcome, Larry.
Enjoy Malaysia.
Yeah, well, and I will continue to write about my experience here. And obviously, when I return back to New Zealand, I will be subject to a 14-day quarantine. So I'm looking forward to living the reality of what policies these other people make.
Okay, well, have a great time, and I'll speak to you soon.
Well, talk soon. Thanks, Eric.
We hope you've enjoyed this Straight Talk in the COVID Economy podcast. Thank you for listening. And please subscribe on your preferred podcast platform. For more information about Resilient Futures, please visit www.resilientfutures.com, and please support our partner, Impact Africa Network, at www.impactafrica.network. We need all the support we can to help them build their own incubator. We know that there are many other great podcasts out there, and your time is precious, and you chose to listen to Straight Talk in the COVID Economy. And we appreciate that. Thank you.